Hi, how are you? My name is Carrie Fessler from Elite Specialty Care. Today we're actually having a few dialogues on animal care during COVID-19. We have several different dialogues set up on Daily Living Dialogues. We actually have a Facebook page if anybody wants to access that. But today we want to talk about pet care with Dr. Hamden from Totowa Animal Hospital, who is actually my personal vet, and I love him. He's fantastic. He has really been there and supported my animals, and he's the best. So we really wanted to get him on and talk about, pet care during COVID-19. Also, I have Tiffany Engel with us, and she's got this beautiful little baby with her. And Tiffany is a pet blogger, and she does a lot of fundraising activities for rescues. She's with prestigious Pet Palace. So we're going to kind of have a little dialogue about pet care during COVID-19. Tiffany, would you like to start?
Sure. Great. Thanks so much, Carrie. And thank you so much for the time. So my name is Tiffany Engel, as Carrie mentioned, and this is Annabelle. She's my little foster. I'm fostering her from St. Hubert's Animal Shelter in Madison, New Jersey. I also do a lot of fundraising events for Wise Animal Rescue, and just got introduced to St. Hubert. So, being a former dog owner and now foster, and understanding some of the concerns that my friends and family have also been communicating to me, it's really important that we as a population are taking responsibility for keeping our pets and our homes and ourselves safe. So I think I'm really excited today to collaborate. And what I'd like to do is, if it's okay, ask you a few questions around some of the concerns that I've had, as well as some concerns that a lot of close friends and family have had as well. Would you like to also introduce yourself too, in terms of the type of in terms of your practice?
I'm Dr. Hamden, Adele Hamden. My practice is at 819 Riverview Drive in Totowa, across the street from Home Depot. Yay.
What type of animals do you treat, Doc?
Basically, mostly cats and dogs. And I see, some wild animals. I see some pocket pets, rabbits. Not much of that though. Actually, there are a lot of other veterinarians that are better than me on those little
animals.
Yeah, so I concentrate mainly on the cats and dogs. I would say that I have a good handle on that, but I don't have a good handle on rabbits and chinchillas and all that stuff. So I leave it.
Well, I know when I switched over to you, you had found some things that were missed previously. So, I feel so confident in your ability to take care of my animals.
Thank you. That's very kind of you. Basically, did you want me to say anything about the?
Not yet. Tiffany's going to ask questions now.
Great. So Dr. Hamden, there's a lot of concerns right now. If my pet gets sick, right, we obviously want to make sure that they're getting the best care, and understanding how to be able to go to a veterinarian's office during these times. Keeping ourselves and our pets safe is priority. So can you tell me a little bit about how your patients are handling in-office visits, what you're asking them to do when they're bringing an animal to see you?
Well, basically, we try not to have too much interaction as far as face-to-face with our clients, even though we do get all our information from them over the phone. And of course, they give us all the information that usually they give me when they are standing with me in the examination room. And we actually asked them to come in and give us a call as soon as they get into the parking lot. And we had already prepared their charts and everything. And most of the time we already have an idea why they're coming. So if it's something that's going to be lengthy, we have a certain type of process that we do. If it's something very fast, like will take 2 minutes, 3 minutes, 5 minutes, we can do that also. But we do go to the curbside and we take the animals from their owners. Of course, our attendants, they are gloves, they wearing gloves, they have masks on. They ask questions to our clients, whether they're is anybody in the household that has the virus, or are they been in contact with anybody that has the virus? Initial stuff that would give us an idea how to proceed.
So I have a question for you, Doc. Can my dog get the virus?
He cannot get the virus, even though we have a cat that, not in my office, of course. This is the cat from the zoo, the
Yes.
tiger, and it's not a joke, and it's not just somebody just made it up. No, it is true. The virus have been identified in a veterinary lab, and it's documented very well. The tiger came down with a little cough, very mild symptoms, and I presume that if they have these symptoms, that means they have the virus, and if the virus was isolated from them, then most likely the virus could travel to other person, to the same person again, or
Interesting.
or
What about house cats? What about house cats? But as of right now, we don't have any, you know, any stories or any documentation of any dogs contracting the virus here in the States.
No, but theoretically they can carry the virus. I mean, if somebody has the virus and then they kiss the dog, on the hair or the lips or whatever, on the face, then definitely the virus will be there. I mean, it's not like well, they will not catch it, but they will carry it though. If somebody else comes and, if let's say that somebody brought me a dog, and we took it into the hospital, and they had already, if it has been exposed to the virus, and just carrying it on their fur, or on the leash or the handle, or any of those things, we can, if we touch it and then we touch our nose or our mouth, then we probably can get it that way.
So really, the
But
meat
as far as,
really.
but as far as they carry the virus, they get infected and they give us the infection, no such thing so far, dogs wise. The cats, as we said, the one that is in the Bronx Zoo
Right.
is the only one that there is so far.
So Tiffany, I know you had a couple of more questions for Doc.
Yeah, no, that's very interesting, and thank you for sharing that. I've seen, a lot of people even go to extremes to create, custom face masks for their own pets. Is that something that you recommend in your experience?
No, just for a joke. That's all. I wouldn't do that for my animal. I have my animals, and none of them. Even though honestly speaking, I have some of my clients brought me masks for dogs, masks for cats, and masks for me too.
That's sweet though. So
Okay,
is there any practices? So my dog park is open where I live, and I've been going in it. I haven't been in a few days because it seems to be a place where people are congregating. Touching other people's dogs. Like I've been avoiding touching other people's dogs or letting people touch my dog. Do you think that we should follow some type of protocol when we bring our dogs out?
Absolutely. I don't think the separation should be for everybody. This is my opinion. I think that just simply because I hate to refer to them as it's just like any other, like a table in the house, or a chair, or a towel or something like this. The dog can, just like our clothes, their fur can carry the virus. I mean, I'm not gonna go through spraying them with Lysol every time they somebody, but if you're worried about it, it's not a bad idea. You get like
With the doggy wipes, I've been using the
a
doggy
wipe,
wipes.
Yeah.
doggy wipe, or
Yeah.
even a regular wipe. Alcohol wipe might be a good idea on the fur itself. Not, of course, avoid the eyes, avoid
Wow, I
the
didn't think about that.
but everything else you can do that. The paws. Now, you said something about somebody outside, walking around, worried about that the dog is going to bring the virus to the house. That is kind of unlikely. It would be very, very, very far fetched, really.
Okay, great. So Tiffany, did you have any more questions, Cap?
Yeah, no, that's really helpful. Thank you for sharing that insight. I myself have been using wipes after I've let her out and go for walks as well, just to make sure that I'm protecting her as well as my home and myself. So those type of infection control practices I think are great. In terms of other things, I've been trying to social distance her from other dogs as well. So I think that's something that has been recommended. But one concern I do have is, she happens to be, a foster, and I had to get emergency dental work on her because when she was admitted, she had a lot of decay and bacteria into her mouth. So, I know that they're basically trying to stop any elective procedures, including spaying and neutering. So, is that something that you find beneficial now, considering everything that's going on, or would you recommend the same practices in your practice?
Well, I think I not I discourage people from things. Some the viruses that we protect pets from, dogs and cats, like rabies, distemper, Lyme disease, all that stuff. This still exists. I mean, if anybody is due for the shots and they worried that taking the dog for a walk, the dog might get a Lyme disease.
Mm-hmm.
I think I strongly recommend that they do continue with their prevention practices that they've been doing all along. I mean, within reason, of course. I mean, it's for procedures like the one that you mentioned for the teeth. Definitely, I would do something like that because it could probably get worse. The infection
Sure.
can cause kidneys, what have you. Dogs that have tumors that are they should be attended to, if not an operation, a biopsy at least, just to be on the safe side. So if it's benign, maybe we can wait. If it is not, then we should do this surgery. I have been doing surgeries like this all along. I would like, if somebody brings me a dog that I'm almost certain that it's a fatty growth or
Mm-hmm.
something that's not really has to be done, I would rather postpone them. The regular cleaning, for like a yearly cleaning for the teeth, is not necessarily an emergency. I would, just wait for that until things get better. We have limited. We actually, somehow our hours have been shortened a little bit because we don't have evening hours. Everybody's home, so we don't have to stay late. We try to do as much as we can. The emergencies, we always ready to go for those. The
Mm-hmm.
emergency centers are open 24 hours a day, most of them, and they are willing to take anybody, even with dogs that come from households that have the virus in them. So they advise that you wipe down, with alcohol wipes or, something that's disinfectant that kills the virus.
Well, thank you so
Um,
much
Great.
for that
That's
information.
really helpful. Thank
It
you
was
so
helpful.
much for your help.
All
you're
right. Well,
very
thank you so much, everybody. I really appreciate everybody taking the time to do this and give this information out. And I was super educated today. Again, thanks so much. Have a great day.
Thank you,
Thank
Carrie.
you.
Take
Bye.
care. Bye
Take
bye.
care. Bye-bye.